Sponsored by Dennis J. Courtney, M.D., Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002 for Dennis J. Courtney, M.D.
Good morning, everybody. Good morning, everybody, and welcome to AM Impact on Your Health. AM Impact on Your Health, where every day our goal is to have you learn at least one thing to help you live better and longer. AM Impact on Your Health, heard each and every Monday, Wednesday, and Friday from 8 to 9 o'clock. I'm Dr. Dennis Courtney, and I'm with you each and every Monday, Wednesday, and Friday from 8 to 9. AM Impact on Your Health, where each day you'll find current medical news, knowledgeable guests, fascinating health topics, and of course, where we do encourage you to call in to join in today. Today is a Friday version of the show. We, of course, will always invite you in here any day of the week, but especially on Fridays as we get them up out of town on this pretty sacred holiday weekend, today, Good Friday. So in the course of our discussion today, we're going to open it up and allow you to come on in at any time. Set the agenda. I've got a number of things to cover with you. One of them is going to be something that came across yesterday in tongue-in-cheek fashion. We'll be finding out what the NCI, by the way, that's National Cancer Institute, is recommending that you should consider in the way of alternative and complementary treatments. I do say tongue-in-cheek because it's the only way I can interpret what I've read over the past 24 hours. Also, too, about half past the hour, we're going to take a break and get with Jerry Singleton. You know, we just finished our big fourth testing seminar yesterday with the NCG machine. A couple things came to light, thought I'd bring them to your attention. And, of course, whatever might be on your mind is okay with me. In the course of our discussion today, I'll be waiting for a knock on the door. Well, how do you knock? Well, you give us a call at 412-825-6262. That's 412-825-6262. I'll hear you knock, and I'll let you in. So, take it away whenever you feel the spirit move you. Coming up on the schedule as it stands right now, on Monday, a gal by the name of Ricky Pepin is going to be here. Once again, I got to tell you that the Freedom of Choice and Cancer Therapy Group, if you don't know already, they've got completely changed around this month. They're going to be, and I was talking to Sylvia yesterday, this is the first time they've ever met on a Wednesday. They may have missed their Thursdays before, sometimes third Thursday, mostly third Thursday, but never on a Wednesday. So you're really going to have to make that change for this month up in Butler, just south of Butler, that is, at the Days Inn, Route 8. They're going to have their featured speaker on Wednesday evening, same time, 7 o'clock at the Days Inn. Her name is Ricky Pepin. She's going to be our guest on Monday. Gets you tintillated just a bit to want to go up and see her in person. Her bio really speaks of, she calls herself a Christian author, a teacher, and a mom. And she's going to be up there talking about her book and what she refers to as a principled approach to the study of health. Now, the book really is written as a testimony to her own work, treating her chronically ill child for whom the medical community said, no help, no solution, we don't know, good luck. Some of that's been paraphrased by me, but that was pretty much what she was told. However, by pursuing her own principled approach, we'll talk about that principled approach on Monday, she was able to get her chronically ill child situation rectified. She then published a book on that subject called God's Health Plan, The Audacious Journey to a Better Life. That's what we'll discuss on Monday when we're with Ricky. You don't want to miss it, and you'll do want to circle Wednesday evening, 7 o'clock, up at the Freedom of Choice and Cancer Therapy Group meeting for this month. On Wednesday, during the day, we do a show here at 8 o'clock in the morning, and it is the same time. There's no switcheroo with the dates and times. We're going to be with Brian Foltz from Standard Process, talking about the many forms of supplementation that the company, a very well-known company, there are a few stalwart companies out there, certainly Standard Process is one of them, talking about various kinds of supplementation, but in particular with emphasis on the thyroid. We'll be talking about that on Wednesday. Now, we'll be flipping the page next week, ending the month of April, moving into the month of May, and got to talk to you about some big doings on here. Now, if you listen to this show a lot, you know we got a special occasion coming up second week of May, 9th, 10th, and 11th, because Dr. Edward Kondrot is going to be coming to Pittsburgh once again for his eye treatment seminars. Now, they have been held many times in the past. In fact, last year, I think, was his record. 4 times last year. Every 3 months, more or less, Dr. Kondrot was coming to Pittsburgh to do an eye treatment seminar. Now, he does travel all over the country with these seminars, but he has a special fondness for Pittsburgh because, well, he's from here. And he had his practice at Mount Lebanon when he was here. Since, however, he has moved to Phoenix, he moves around the country offering people very unique ways to treat their very problematic and difficult eye conditions. You know who you are out there if you do have an eye condition, and it's just not responding to the conventional therapies that you are pursuing. We've heard from you many times, you as a group, meaning those with eye afflictions that just have become static and no additional improvements are being recorded by you. By following what your doctor tells you, you're the very person that more than likely should consider being treated by Dr. Edward Kondrot over a 3-day treatment seminar program to be held May 9, 10, and 11 right here in the office. That's the big difference this time. No longer to be held at a hotel, being held right here in the office. I'll have a chance to be working with him and with all of the patients who are participating in that treatment seminar. Now, there's another special deal, too, in that as he comes to Pittsburgh, he does offer a general seminar for those who have an interest in learning more about how he might be able to help them with their eye problems. You may need to get some questions answered before you jump in to be treated in one of the eye treatment seminars. You just want to get some information. Well, this is the perfect way to do it. You'll be able to do that on the Monday evening, the 9th of May, 6 to 8 o'clock here in the office. I'll be looking forward to meeting you then also myself. Dr. Kondrot will usually do a lecture called The 10 Surefire Ways to Prevent Eye Disorders or to Correct Your Vision Issues. And I hope I'm paraphrasing that correctly. And then I usually speak a little bit of time myself. And then we both take questions and allow you to ask us questions till literally you don't have any more to ask. And it's a pretty good evening. You get literally a free, not maybe one-on-one questioning and answering period, but everybody tends to benefit from it. In either case, if you don't want to be involved in the eye treatment seminar, or if you want to be a participant in the general seminar, give his offices a call so that they can reserve a seat for one or either or both. That number is 1-800. And by the way, please don't dial it now. You really should be waiting until around noontime around here, because they'll just be stirring out there in Phoenix at that time and entering the office. So the number is 1-800-430-9328. That's 800-430-9328. Dr. Edward Kondrot coming to town, and we'll try to get him on the show one more time, maybe next Friday, before he gets here, to give you an opportunity for some final questions here. Then, in the month of May, also, Susan Smith-Jones is coming on back here. She's going to be finishing off her discussion about that spring cleaning. I guess better word is cleansing. And when the word cleanse is used, you got it. It's detoxification time. She wanted to specifically pay attention to skin issues and detoxification, and we will do that on the 4th of May. And then we've got David Brownstein returning. He's going to be coming back on the 13th of May, talking about, and that's a Friday, talking about thyroid issues again. As I mentioned the other day, the change has already occurred in my office. There's a lot of emphasis over the many years in the past with respect to women, and I do believe the men have been shortchanged. I think it's time to delve into their issues, and we had at it yesterday with what I guess we'll call the launch of that. But these thyroid problems are ones that are just indigenous to our area, and the strong relationship between thyroid and cardiovascular disease, which has always been a favorite of mine in terms of treating it, offering unique approaches to it. As it turns out, the link is so strong, it really can't be ignored. And with respect to treating concomitantly both thyroid and cardiovascular disease, I believe the time has now come. Okay, that's pretty much the way the calendar is shaping up. Why don't we do this? I'm going to take a short break. When we get back, I'm going to share with you my thoughts with something that came across my desk literally yesterday, talking about alternative therapies recommended by the NCI. Boy, when you want to catch my attention, mention NCI and alternative medicine in the same breath, and I'm there. Well, let me take you there with me and explain what I learned in the process, and it is a tongue-in-cheek exposition. Be back in a moment.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you are looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, immune system repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
Dennis J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Want to help your family eat healthier? Instead of learning to disguise tofu in wondrous ways, how about some real nutritional power? If your family has the typical American palate for fries, pizza, and burgers, giving your family the blessing of good nutrition is a struggle. Fruit of the Spirit is the answer for your family's nutritional needs. Fruit of the Spirit is an all-natural, whole fruit puree made from fresh fruits native to the Holy Land with alkalizing minerals. Fruit of the Spirit was 5 years in the formulation, the work of a team of top nutritional experts with independent science to confirm its antioxidant power. 1 ounce a day provides the equivalent of 5 servings of fruits and minerals. Fruit of the Spirit is convenient, affordable, and delicious. Even your picky family will sing the praises of Fruit of the Spirit. Give your loved ones the blessing of good nutrition. Call 1-800-442-3793 for a special promotional offer. Fruit of the Spirit, a blessing for your good health. That's 1-800-442-3793. Call them now, 1-800-442-3793.
Hey, good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health. Heard here on KHV 620 now today in our Friday version of a show. Good Friday version at that. And allowing you to come on in and participate too by saying give us a call if you have anything on your mind whatsoever that you'd like to discuss. 412-825-6262 is the number to do that. You know it so well by now. And don't be shy. Get rid of that pressure buildup because, if you don't, you're going to explode. Get whatever's on your mind, get it off your chest. We'll be waiting to hear that knock on the door to let you on in the store. Now, one of the things I wanted to share with you today came across my desk literally yesterday. I'm always searching the blogosphere to find out what little morsels are out there. And anytime I see in the blogs a mention made about alternative and integrative and complementary medicine with respect to cancer, and cancer treatments, it does get my attention. And so while I was moving through Huffington Post yesterday, I oftentimes do scan that. They got a pretty extensive health section in the Huffington Post. I came across this little ditty which absolutely caught my eye, talking about, and here's the byline, alternative and complementary treatments for cancer. Now, That one always grabs me. I'm interested to find out what is being offered out there. To come to find out, then literally in the opening paragraph of the teaser there, that this was coming straight out of the NCI. Now, NCI is just not a casual and know-nothing institution. NCI is the National Cancer Institute. Now, this is one of the most prestigious investigation groups out there in the entire world, let alone the United States. And so when the NCI speaks, I guess it's safe to say everybody listens. Sure, I do. And the NCI is hooked up with NIH, which is another one of these big organizations that kept my attention. And of course, the NIH is the National Institute of Health. So in the blogosphere yesterday, NCI is putting out some information to help you consumers, to help you potential patients out there with respect to identifying alternative and complementary treatments for cancer. So as I start to go through it, what is it that they think could be helpful in the alternative realm to help you with cancer? And this is when the things started to go off the cliff as far as I'm concerned. You'll see what I mean here in a moment, because they start out talking about what you need to do is to set up a team. You need to be assertive in finding out what here's one of the recommendations right off the chute. You need this treatments may be readily available, or alternatively, you may need to be assertive in order to find and access them. Well, I can understand that. It is difficult to find practitioners who are able to provide you with these alternative therapies, but nonetheless, with a little bit of due diligence, you should be able to find them. Once you've found them, it gets confusing to me, because the very first thing they say that you can expect the alternative and complementary therapies to do is help you in the stages that patients and their families can expect to go through as you lead to your demise. I think I can only interpret it that way, folks, because they say the real role of the team in helping out an afflicted individual with cancer is described best in a book called, now here's the title of that book. The book is called Saying Goodbye: How Families Can Find Renewal Through Loss. Now I wonder how that grabs you if you're the afflicted one and has the cancer, and the NCI is trying to help your family form a team to, well, best said, and that's the way the quote reads here, the best description of what this team can do is said in the book entitled, I'm going to say it once again, Saying Goodbye: How Families Can Find Renewal Through Loss. Now, that one maybe started to deflate the balloon just a bit, and it really did deflate mine. More about this team, though, that's supposed to help the loved one cope better with, I guess, the impending doom. And this, by the way, is not the way we approach the cancer treatments that we provide here in this office. And it is not, and does not bespeak of how alternative cancer therapies should be viewed, especially by the consumer, and most especially by those who happen to be afflicted with cancer. So I read with great interest then to find out how the NCI thinks that forming this team should be helpful in a situation where someone is afflicted with cancer. So here it is. Number one, they say some family members of the team can be asked to help out by attending doctor appointments. This is the advice from the NCI, and that, of course, with the consent of the patients. And when they go to these doctor appointments, the NCI feels that you could really be helpful by taking notes. I swear to God, that's what they think could be helpful here. Okay, number two. First was set up the team. That was number one. Somebody in the family needs to step up and actually create the team. That's number one. Then number two, somebody from the team needs to go and attend doctor's appointments and take notes Number 3, other family members may pitch in with chores. I am not kidding, folks. This is what the NCI is advising you to do. Pitch in with the chores. And number 4, some may take on the responsibility for researching the particular disease that the patient has been diagnosed with, along with treatment options to try to find out what some of the alternative and complementary treatments for cancer actually are. They, up to this point, have mentioned none of them. And the byline for the article, alternative and complementary treatments for cancer. Really a deflator at this point. Does the article finally get to recommending alternative treatments for cancer? Well, yes, in fact it does. And at the closing of the article, the one cancer therapy that the NCI is recommending that the family, the team, go out and take some notes on and be able to educate and make recommendations when it comes to the use of it is the use of acupuncture. This is the one treatment that is spelled out, which, by the way, I would agree with. I think acupuncture is a wonderful modality. And the acupuncture, they readily say, according to the NCI, there is no substantial evidence that acupuncture cures cancer itself, which I actually think is a true and correct statement. However, let's take a look at the results of studies look at acupuncture with respect to symptoms. To use acupuncture for symptoms is fine. To find out that that's what the NCI thinks is only what is available in the realm of the alternative to deal with cancer is, well, it's a jaw-dropper, folks. With respect to the acupuncture, yes, it could be helpful in the areas they mention and point out, that of dealing with pain, dealing with nausea and vomiting, and dealing with fatigue, which, by the way, pretty much all three come in close conjunction with the use of chemotherapy and radiotherapy, which are the main provocateurs of pain and nausea and vomiting and fatigue. So that's what caught my eye yesterday. I now come back to you and report to you what I found, as I usually do. But now let me add on, I think, what I've usually referred to in the office when I actually talk to families, I guess, who have already formed the team, because I do see them here coming in a group, and that is, where's the beef? I always ask the question to them. They're here to find out the various things that I might recommend, but they oftentimes come to me and are checking with me to see if I approve of things that they've discovered while moving through the blogosphere. And I always ask them to confine themselves to one point, and here's the point. I ask them, where's the beef? Where is it in the therapies that you are researching that there's actually a cytotoxic component, the actual component meant to deal with and eradicate the cancer? Essentially, in other words, what do you have in your plan that is meant to kill the cancer, kill the tumor, and as a result of that, eradicating the tumor? And this is where things usually get bogged down. I actually now I'm going to pass off to you what I think the NCI should be telling you, because it comes right out of NCI, and it's something that I allow every one of my patients who comes here and discusses cancer with me to leave with a copy of. And that's an article published in 2005 coming right out of the NCI. Now, why they didn't mention this is beyond me. Talking about alternative and complementary treatments for cancer, I believe this is the big one. And this is the one that is the take-home message that allows those patients to have hope and doesn't, saying goodbye and how families can find renewal through loss isn't the way I would describe how we should be pursuing the treatment of a cancer patient. I'm just sorry, that is ridiculous. But what should you do? Well, I would say take me up on my offer. I have an article from the NCI, the National Cancer Institute. I have spoken about it before. This is published in 2005. The chief investigator here was Dr. Mark Levine. And in this article, he goes on to prove how high dose intravenous vitamin C actually kills cancer. He elaborates the mechanism for how that is accomplished, and he's almost 100% correct on his elaboration. And it is this kind of material that patients are really looking for. These are the things they really want to know. They don't want to know about a team that allows what saying goodbye, how families can find renewal through loss. This ain't it. If you do one of two things, provide me with a fax number, give us a call, or send a self-addressed stamped envelope. I will send you a copy of this article. It is in my file cabinet next to my desk, and I hand it out freely and would love for you to have a copy of what the NCI evidently doesn't think now that you need to know a thing about. Instead, get a team together and do some chores. And that's the end of the tongue-in-cheek expose from the NCI. Hey, there's a quick call on the door. Knock on the door. Come on the store. Hello and welcome aboard. What's on your mind?
Good morning, Dr. Courtney.
Hi.
Hi, I just had a question for you. If someone has been diagnosed with lymphatic cancer,
Okay.
Would it be contraindicated to have lymphatic drainage, or would it, in fact, be better for that person to have lymphatic drainage?
Well, with lymphatic cancers that may end up obstructing flow, this is a very low-pressure system, but lymphatic drainage, no matter what the situation, no matter what the setting, even in settings of cancer, certainly is a plus. It's a positive. And allowing the free flow of material, you can't ever support blockage that allows for the inhibition of flow in the lymphatic system, no matter what the diagnosis. So
Okay.
it's a pretty easy question to answer, and although I would say if there's enough of a blockage in the lymphatic system, it's such a low pressure phenomenon, it doesn't take much to completely shut it off. And you really do have to relieve the obstruction in order to be successful with the lymphatic drainage. But should you do it at all? Absolutely.
Okay. And then the other comment, real quick, was, you know Tim Robbins, the actor?
Yes, I do.
Well, his mother, I guess, passed away for different reasons. I think she was in her 90s or 80s. But it mentioned in the story about her life that she had cured herself naturally with supplements of colon cancer.
Oh, I
I
did.
thought that was interesting.
Yeah, I'll be searching for that. I didn't come across that. Is that a recent thing? Is that something?
Yeah, it was in a write-up, I think on Monday.
Really? I missed it.
Mm-hmm.
I wish I would have come across it. It would have been more helpful to me than the one I did come across, because I think this is just trash. This is rubbish about finding a team to help with the chores. This is just so ridiculous. Anyway, I always thank you for your input.
Thank you.
Okay.
Happy Easter.
Same to you. All right, there you have it, folks. We have weighed in, and to take me up on my offer, I think that every family needs to be armed with information, correct information with respect to what is out there, and because the administration of high-dose intravenous vitamin C, and by the way, it must be non-corn derived. You understand the non-corn derived issue. It must be non-corn derived vitamin C. Is able to absolutely kill cancer tissue and not harm healthy tissue, not harm the good tissue. It will only and selectively kill cancer cells. It will not harm in any way your good cells. And that's the kind of therapy we should be moving to, the non-toxic therapy, the non-pharmaceutically derived. And if you want to copy the article, either a fax number or a self-addressed stamped envelope, I'll be happy to send you a copy. You need to have it in your arsenal, just like I have it in mine. Okay, let's take a short break. We had big doings going on here yesterday. We just completed another, I don't know the exact number, I'll let Jerry tell us, of the MCG testing, you know. So I said, hey, Jerry, come on back this morning. Let's talk a little bit about some of the things that went on yesterday. So MCG testing gets complete for the month of April. We'll have another one in May, folks. Get ready for it. Get ready to be able to participate today, too. 412-825-6262. Be back in a moment.
sugar complaint list? Even if your doctor asks you what you eat, the recommended 5 servings of fruits and vegetables a day is a dream in your busy schedule. What if you learned of a product 5 years in the formulation that delivers 5 servings of fruits and minerals in just 1 ounce? That's right, it's Through the Spirit. The blessings of Through the Spirit are now formulated into a delicious whole fruit puree product rich in antioxidants and minerals. Your health is more than just a test result. It's a balance of physical, spiritual, and emotional factors. You work regularly to strengthen your faith. Let Through the Spirit help cover your nutritional needs in a convenient and cost-effective ounce a day. Call 1-800-442-3793 for a special promotional offer. Through the Spirit, a place for good health. Through the Spirit, 5 servings of fruits and minerals with no added sugar. That's 1-800-442-3793 for your good health. Call them now, 1-800-442-3793.
This is Dennis J. Courtney, MD. Have you become confused about how best to manage your health? It's no wonder. It seems that every time you turn on the television or radio, another expert has yet another suggestion for you to follow that seems to be reasonable enough, but no matter how dutifully you follow the instruction, it just doesn't quite produce the results that you were looking for. If this confusion sounds familiar to you, give us a call at the Center for Complementary Health, where we'll make some sense of the confusion based on a blending of traditional and alternative medicine that we've been perfecting over the last 7 years. We offer metabolic nutrition testing, process repair, natural hormone replacement therapy, chelation therapy, cutting-edge allergy correction, and a host of other safe and effective alternative therapies.
J. Courtney, MD, is located at 3075 Washington Road in McMurray. Phone 724-942-3002.
Good morning, ladies and gentlemen. Welcome back once again to AM Impact on Your Health here on a Friday morning version of the show. It is a get 'em up out of time version of the show. You can step in here and take it away at any time. Knock on the door by calling us at 412-825-6262. I thought it'd be interesting because of the festivities around here, folks, who are focused on the 21st, to conduct our 4th testing seminar here, testing extravaganza with the use of MCG. And of course, we've become associated with MCG by a gentleman that needs no introduction. He's frequently heard here on the airways. His name is Mr. Jerry Singleton. He was in my office yesterday doing what he does best, testing a whole bunch of folks. Thought I'd share some issues with him, allowing you to listen on in to some of what we talk about with respect to this testing. Jerry, good morning and welcome back. Thanks for coming aboard today, my friend.
Good morning. How are you, Dr. Courtney?
I'm doing well. Have you recuperated, recovered? You do a fine job, Jerry. When you come in, you give it 100%. I will say you remain very enthusiastic and energetic about this kind of testing, and you do it literally every day of the week. I mean, from Monday through Friday, they do give you off on the weekends, don't they, Jerry? Don't they?
Sure do, yeah.
All right.
They absolutely do.
All right, well, they work you hard enough during Monday through Friday. You absolutely deserve to have your weekends free. Yesterday, you were in the office. How many do we ultimately get tested, Jerry? What did we see yesterday?
We got 23 tested yesterday alone.
Okay, so 23 more notches in the belt. 23 more people who are going to be able to find out what their cardiovascular status is through the use of this interesting device called MCG, standing for multifunctional cardiogram. Why don't you quickly tell us once again what that is? You do it better than I do.
Well, sure. It's a device that we use for coronary artery disease. Most patients identify with the plaque development of the arteries. It's very, very common, especially in these surrounding counties that we live in. We have some of the highest concentrations of it, and like I said, it is the #1 cause of death. It's the #1 cause of emergency room visits. So it is very, very serious. It's what would lead one to a heart attack or stroke, or to require bypass surgery or a stent. And so for those reasons, and combined with the fact that coronary disease often many times doesn't present symptoms or presents minimal symptoms, gives us the ability to test patients in a resting setting, a 6-minute test where we can gather information from that patient so that we can produce a report back for them that's highly sensitive, highly accurate, relating to the accuracy of the way the machine collects the data and so forth, and scores them for coronary artery disease. And then what we do is we get a report back for them so that we can review with them. If they are a little high, we can talk about some ways to bring that down, some variables that affect that. If they're low, we can talk about some ways to keep them low. And really, the primary reason for this is the fact that many patients will tell you that you see at a cardiologist's office that have had their first heart attack that the day or two before they felt completely fine, and that really tends to be a trend that I see quite often, and it's always very sudden. A lot of times patients have no idea that if there was anything wrong with them or that they even had coronary disease or plaque issues until they have that first heart attack. And of course, you and I know, Dr. Courtney, that it took several years to develop that amount of plaque buildup in those arteries. So this really gives us the tool, another tool to early on identify what's going on there so that we can stop that progression or at least slow it, and in a lot of cases even reverse it back slightly.
Oh, well, now you're talking my kind of talk. We're going to get to that in just a minute about we're changing things around, which is I really look at this as the tool to help me do that better than any other ones I've had up to this point. But with yesterday, right off the bat, and I think maybe we should mention it to everybody, we got a slow start yesterday. And the reason why we got a slow start is that device of yours is so touchy. It's so sensitive. We had to move into 3 different rooms before we found the right room, and this was our 4th seminar. So what is it about that machine that makes it so edgy and jumpy? Because it took us 30 or 40 minutes. The first patient was on the table. We had to move him 3 different times.
Right, and that's a great point. And actually, this happens to me somewhat frequently, and for one reason or another here. But what I find is when we now most offices, cardiologist offices, primary care physicians, once they get the machine on a full-time capacity, it obviously sits in, and we they find a location for it that works well. It sits there, and then there's no complications. But of course, we were doing a seminar that we haven't done in a while to the public. So, and it is a 5-lead device. Now, for patients out there that have had a standard EKG, especially females, they'll tell you that they had to disrobe and they had to place a number of leads across the chest. For this test, we've tried to make things a little bit more simple, but yet still collecting the relevant information. And by putting non-electrode leads, basically not those, most patients that have had an EKG will tell you, that they identify with those, sticker-like leads that go on them. They're placed all across them. This gives us the ability to really just use one of those and to place one on just the very left, or P5 is the lead, on the upper left rib cage. And then really what we're doing then is we're placing in place these clamps per se.
Yeah, they're big clips.
Yeah, clips. That's a better word. Yeah, clips that go on each wrist and each ankle, which gives us, and that we consider that lead 2. That would be probably the best way to describe the electrical measurements we collect there. And because of that, those clips can, and there's metal on the inside of that clip, but because of that, those clips specifically can be more prone to interference from, if there's nearby equipment that has, some kind of live battery or something, it's some kind of computer type device that's putting out, some kind of an energy in it that, it can interfere if it's very, very close to the patient. So, for one reason or another, we try to get this device, multifunction cardiogram machine, into a room that has the least amount of medical equipment, the least amount of live equipment that's certainly plugged in and emitting, some kind of a charge. And because it does, for one reason or another, it does put off some interference that could impact those wrist and ankle slip leads, which we would identify with lead 2.
Okay. Well, so I just wanted to mention for some folks who came much later in the day, didn't realize that we had a 30-minute crimp in time, literally. And although we never got too far away from our schedule, if you were in here and you had to wait longer than anticipated, because it should be going much smoother than that, it's because we got a slow start because of getting this thing set up to begin with. I think now, Jerry, we know the room to go to, we know the setup to move to, and so no more experimentation should be needed at any other time in the future when we do these little treatment seminars. You'd agree, wouldn't you?
Oh, absolutely. And
yeah, that's
typically when a device is, when we bring a device like this into an office, we kind of find which room works best and which room has the least.
Oh yeah, you're running around, you're pulling plugs, and you're moving objects because this thing is so touchy. But
yeah, because we do that because we want each measurement that we collect for the patient to be of the highest quality and of the highest accuracy. And to your point, I think at the furthest. At one peak, at the peak of the day there, we might have been at most 20 to 30 minutes behind. It's just one, and then I know we caught up rather quickly. But we really were on schedule for the majority of the day. That we did a very good job of getting the patient.
6-minute test, and yes, you were.
Pretty timely.
Now, every time you get done talking to Fancy Talk about what this machine does, I come in with the crude way of saying it, because I think it's pretty accurate, and that is that this test, in my opinion, enables us to receive the information that one would get about an individual's status as if they had a full-blown cardiac catheterization without ever having that cardiac cath. Now, isn't that really, Jerry, why don't you just use my words, because isn't that a much easier way of saying what you just said in 5 minutes, okay? And I did it in like 30 seconds.
Yeah, well, hey, that is a great way to define it. It's really the technology has built into the control group of the database parameters that we use in scoring the patient's force. It has a component that those 42,000 patients built into that control group have had this test and the heart cath or angiography. So we certainly rely on data that was derived from that when developing this technology. And certainly in a number of medical studies that have been published out there. I know our most recent publication, we've been published in JACC, the Journal of American College of Cardiology, which is, as you and I know, Dr. Courtney, is the real authority on all things cardiovascular, where the New England Journal of Medicine might be for other physicians, what the JACC is for us that are really focusing in on cardiac medicine. But in these articles, we've been identified as being within about 90% accurate, give or take a percentage or two there, one way or another, of knowing the severity of a cardiac cath or angiography, cardiac angiography, and really this device starts to pick up for us abnormalities at about the 30 to 40% occlusion rate or blockage rate. And what's nice about this technology is it provides us such a scale, such a range of data. So for patients that are that are maybe younger or maybe don't have as many complications, we can get a score on them that would let us know that they are very their risk factors are very low, and yet still where that risk stands. And certainly if they're tested in the future or every year or whatnot, we can monitor the progression and make sure that they're staying low. So it really gives us the capacity to test all severities of of disease severity from no detectable level of coronary disease, mild, medium, severe, all the way up.
Now, yesterday we had a first occurrence where a previous couple that had been tested really were questioning results, and I'll tell you why, Jerry. They questioned because it had to do with time stamping and so forth, because the reports actually did time stamp. And you know the couple I'm talking about, where we retested them simply because there was some doubt about the initial test. How did that go? How was that resolved?
I remember the two patients you're talking about, a lovely couple. They, you're right. Several months ago, when we had tested them for the very first time, they had believed that. I believe the one, I can't remember if it was the wife or the husband, one was tested before the other, and they felt that maybe it was in the reversed order to their memory, because one had a very, very low score and the other had a somewhat a higher, more severe score. So they wanted, it was very important for them to know to 100% certainty, who was, which was which. And of course, I have a lot of confidence in the way we enter this data, and really that we have a system in place that kind of checks and balances me, because not only do we have to put the data in, birthday, age, male, female, first name, last name. Not only do we have to put in a range of data into the device itself, the multifunction cardiogram, but I also have to input it into a laptop that's only for the purposes of collecting clinical data on each patient, which we use to try to get information for them relative to their condition. So in their case, we believe we had done everything right the first time. I know you and I were very confident that we did things correctly, and this is really the first time that something like this was ever questioned. But like we had talked about, there was absolute no problem in retesting them, and sure enough, and when we had retested them yesterday, their scores came back very consistent. Now, listeners out there might be saying, so what? What does that mean to me? Who cares? But really why that it was kind of also interesting, and I think that the patients would agree, is the fact, and you and I certainly agree, is that this test is very, very repeatable. One day, if we test an individual, no technology should one day produce a score of X, and then the several months down the line produce a score of Y, which is significantly higher or lower. It should be within about the same range. And sure enough, blinded to that, it was very, very accurate, very repeatable, and consistent with that first testing score, which is always encouraging.
Well, yeah, too, and it's going to set up, the other testings on this couple really just wanted to get this cleared up in their mind, and we were happy to do the test again. But there'll be other people coming up that didn't question the first score. They're just due for another retest. And over time, we're going to see that the same sort of numbers emerge, and it's going to be their validation, as I see it, Jerry. So I think I'm happy to see that there was consistency, correlation, and accuracy that allowed that couple to know that their first results were actually right on, because their second results were, if not directly the same, they're really close, right?
Absolutely.
Okay. I think there's a knock on the door. You want to come on the store, whoever you are?
I'd like to ask, what other offices do you go to? I'm going to hang up because my cell phone's dead.
Okay.
I go to a number of offices, and there's also a number of offices out there that, again, have their own equipment all across Western Pennsylvania. I know Dr. Courtney, he's pretty central to, for a lot of individuals. He's located in a pretty nice location in McMurray, PA, which is pretty accommodating for a lot of people out there. But we certainly have some
Uniontown. I mean, you go to Uniontown, Brownsville. You're out in the hinterlands a lot with this.
Yeah, well, we have Allegheny General Hospital too. Which would be central.
Okay.
We have Clarion, which would be very
north,
I believe.
Mm-hmm.
We've been at Butler Health System, which too would be north. So we're kind of scattered, a little bit scattered all over the board. And again, a mix of cardiologists and primary care physicians, all across Western PA. But I have to say, your location is probably pretty central for most people. That's the one nice thing about where you're located. It's within about 45 minutes. It's just about probably the majority of people out there that would be tested. But certainly, we do have some other locations that are either central or in the outlying areas as well to try to accommodate, geographically as many patients as possible.
And two, should mention that this is just introduced now to this area. So, as time moves on, this is going to become very fluid and be available in a whole bunch of places, not just the ones that are located now. So as time moves on, it's going to be easier to get this, not more difficult to get this testing done, wouldn't you say?
Oh, absolutely. I mean, I really firmly believe that at some point in time, this will be in nearly every office out there.
Me too.
Every cardiologist out there, and probably 70 to 80% of primary care offices out there as well. It's just going to be a factor of time. As this device was FDA approved in 2000, it's been around for about 11 years, which is pretty relatively new for medical equipment. But within this area, we've really only been around in the past about a year and a half to 2 years.
That's what I keep telling.
In other areas, maybe other states, maybe 5 to 6 years. So it's just a factor of time.
That's right. Another knock on the door. Come on, the store. You're with Mr. Jerry Singleton. Go right ahead.
This is your favorite attorney, Doctor.
Hello. This is my brother-in-law. I have to announce to be.
Don't brag.
Don't brag. Yeah. Most of my listeners.
I want to ask your guest a question.
Go ahead, Jim.
Is this appropriate for people who have already had bypass surgery, and is it covered by Medicare?
Absolutely. We are, to answer your second question first, Pennsylvania Medicare absolutely covered with. We're also covered by Medicare in a number of other states. That was kind of a big accomplishment for us. And typically the way this is marketed, to answer the last topic we were just discussing, we generally wait for Medicare and Medicaid, a lot of the major Medicaid products and major, like Blue Crosses. We have Blue Cross. We try to get, we certainly don't want to be going out there and charging patients cash for something. It takes into a question the accuracy of the device and also whether this is truly what it says it is. So it always helps too on the cost perspective for patients to have this covered by their insurance.
Yeah, it's covered. Jim, it's fully covered. Fully covered, Jim. Who was your first? He asked about if somebody has had previous bypass surgery or other interventions, would this device be appropriate for them? And boy, Jerry, I'd love to take that question, but why don't you?
Sure, absolutely. I mean, the two, even three primary indications for this are first, like I said, as a tool to assess patients that have risk factors and have suspected coronary disease or maybe the development of plaque or coronary disease, and want to have that checked out. The next most frequently reason for using this device is for patients that have known coronary disease, that have either had a bypass surgery in the past, have had a stent, maybe they're on cholesterol or blood pressure medications, but they absolutely know they have coronary disease. And the reason for that is even if they had a cardiac cath the day before, what this can do for a patient like that is give them a score on our system from 0 to 20, letting them know where they stand with regards to that atherosclerotic buildup. That stent and bypass surgery is certainly meant to correct any obstruction in blood flow. So their score should be reduced from the day before they had that intervention to the day after. But really the most important component for a patient that has known coronary disease is the fact that we can track them over time, every 3 months, every 6 months, every whatever is appropriate medically for their condition, to make sure that there's not that progression of disease which tends to go with coronary disease, and two, that there's not restenosis developing from that stent or bypass surgery, which is another concern physicians have. So most absolutely. I mean, that's those patients should always be tested. It's just a question for other patients. How often other patients should be tested, but absolutely anyone with known coronary disease should be tested at least one time a year.
There you go.
Another question.
Go ahead.
Okay. Does this device go by vessel or by area of the heart? In other words, does it monitor each and every vessel like a catheterization, or does it look at areas of the heart?
That's a great question. What it's doing, because it is a non-invasive test, it is a 6-minute resting test. Obviously, we're not opening the patient up. We're not using, like as we do in a Prasantine or a Cardiolite type stress test. We're not taking, a 3-hour, procedure worth of films and so forth. So the one downside, we're not identifying specifically where that blockage is. We are able, though, to determine if they have coronary disease and two, how severe of a degree that is, which is really always the two most important questions with coronary disease. Now, once we know a patient has a high degree of coronary disease, then of course if appropriate, we can determine through another means where that blockage is if we have to correct that. But as long as we can manage it with lifestyle changes and diet and exercise, medications if appropriate, other treatments, non-invasive treatments, then that's not always the most important information to have. But if it is needed, there is other machines out there to do that. But to answer your question a little bit more thoroughly, it does take into account multi-vessel disease, single vessel disease. All that is taken into account. We're just not able to specifically tell you if that disease is in the left superior descending artery or the right main.
Tell you what, Jerry, that's a very good answer. Thanks, Jim, for your call-in. Thanks, everybody, for listening today. Hope you enjoyed the show. Jerry, I didn't get to my favorite topic. You've got to come back, and you know what we're going to talk about. We'll do it next time. Until then, ladies and gentlemen, have a wonderful weekend, wonderful holiday weekend. Be safe. See you on Monday. Don't forget, the guest on Monday is going to be talking about her saga with treating her child in a way that everybody else said couldn't be done. We'll be with her then. Until then, this is Dr. Dennis Courtney with Jerry Singleton, saying so long for AM Impact on your health.
Director of the Courtney Medical Group, located at 3075 Washington Road in McMurray, Pennsylvania. For more information or to make an appointment, call 724-942-3002. That's 724-942-3002.